Laparoscopy, surgical, colostomy or skin-level cecostomy. The physician constructs a colostomy or skin-level cecostomy using a laparoscope. With the patient under general anesthesia, the physician places a trocar at the umbilicus into the abdomen and insufflates the abdominal cavity. The physician places a laparoscope through the umbilical incision. Additional trocars are placed, through which the specialized surgical instruments are inserted. The selected segment of colon or cecum is isolated. The physician brings a loop, end of colon, or cecum onto the skin as a stoma, colostomy or cecostomy, through a small incision in the abdominal wall. The laparoscope is removed, the ports are closed with incisions, and the stoma is matured. Laparoscopy, surgical, appendectomy. The physician performs a laparoscopic appendectomy. The physician places a trocar at the umbilicus and insufflates the abdomen. The laparoscope is placed through the umbilical port and additional trocars are placed into the abdominal cavity. The appendix is identified, dissected from surrounding structures and its blood supply divided. The appendix is transected with staples or suture and removed. The trocars are removed and the incisions are closed. When a patient undergoes a laparoscopic appendectomy and a laparoscopic colostomy, is it appropriate to report codes 44970, laparoscopy, surgical, appendectomy, and 44188, laparoscopy, surgical, colostomy or skin-level cecostomy? According to the parenthetical notes that follow code 44188, it is not appropriate to report 44188 in conjunction with 44970. Since the appendectomy would be considered incidental to the colectomy, it would not be separately reportable. Laparoscopy, surgical, enterectomy, resection of small intestine, single resection, and anastomosis. Each additional small intestine resection and anastomosis. Colectomy, partial, with anastomosis. Colectomy, partial, with removal of terminal ileum with ileocolostomy. Laparoscopy, surgical, mobilization, takedown, of splenic flexure performed in conjunction with partial colectomy. The transverse colon is located and maintained in upward traction. The ligament of Treitz is identified and the small intestine is run. The targeted section of small intestine is marked and suspended with traction sutures through the mesentery. The peritoneum overlying the mesentery is scored and the segment of small intestine marked for resection is devascularized. The bowel is divided proximal and distal to the segment with a stapler. The segment is brought out through an enlarged trocar site. The divided bowel ends are anastomosed with staples and inspected. The mesentery is closed with interrupted sutures. The trocars and laparoscope are removed and the incisions are closed with sutures. Report 44203 for each additional small intestine resection and anastomosis beyond the first. The physician incises peritoneum along both sides to mobilize the colon. The greater omentum and colon are separated by incision to mobilize the hepatic and splenic flexures. The colon is mobilized centrally onto its mesentery and the mesenteric vessels are divided intracorporeally using titanium clips. The colon is divided with an endoscopic stapler, and the specimen is removed through an enlarged trocar site. If the procedure is being performed for malignancy, a wound protector is used. In 44204, the divided bowel ends are anastomosed and inspected. In 44205, for the ileocolostomy with removal of terminal ileum, the abdomen is deflated and the laparoscope and trocar incisions are closed. The segment of terminal ileum and cecum is removed and an anastomosis is done between the remaining ileum and colon and brought out through the trocar site to an opening created in the skin. The abdomen is deflated and the laparoscope and trocar incisions are closed. The attachments between the splenic flexure of the colon and the lateral abdominal wall and spleen are dissected free and taken down in order to mobilize an adequate length of colon in conjunction with a partial colon resection. At the completion of the procedure, the abdomen is deflated and the laparoscope and trocar incisions are closed. What code, S, should be reported for a laparoscopic takedown of the splenic flexure in a partial colectomy with anastomosis? Code 44204, laparoscopy, surgical, colectomy, partial, with anastomosis, and add-on code 44213, laparoscopy, surgical, mobilization, takedown, of splenic flexure performed in conjunction with partial colectomy, list separately in addition to primary procedure, should be reported. Multiple procedures modifier 51 should not be appended to code 44213 because add-on codes are exempt from the multiple procedure concept.